Hello everyone, welcome to sqadia.com. We are talking about pituitary glands, pineal gland, and adrenal gland. In this section, we'll talk about the clinical correlates of the adrenal gland as to what happens when the development of the adrenal gland does not go as planned and various anomalies occur. So, what are the various important anomalies? These may be the ectopic adrenal gland. We can also have congenital adrenal hyperplasia, and then we'll talk about adrenogenital syndrome and pheochromocytoma. So, first of all, ectopic adrenal gland or ectopic adrenal tissue. So, the normal location of the adrenal gland is suprarenal. Here you can see in the figure, this suprarenal position is actually occupied by a normal adrenal gland. So, in ectopic adrenal gland, the adrenal tissue or complete adrenal gland is either fused to the kidney or it may lie deep in capsule or right lobe of the liver. So ectopicity may be either within the kidney or within the liver itself. So if the adrenal gland is either in the kidney or the liver, it is known as an ectopic adrenal gland. So let's talk about congenital adrenal hyperplasia. So congenital adrenal hyperplasia causes an increase in amount of the androgens that are produced by the adrenal gland. As a result, there is elevation of androgen levels that may culminate in pseudo intersexuality. So, what is pseudo intersexuality? It is false gender affirmation. What happens is genotypically the offspring might be of one gender. However, due to increased androgen levels, the genotypic as well as the phenotypic appearance might change. That is, the secondary sexual characters might develop, and even the clitoris may enlarge somewhat. The development and the appearance maybe in such a way that an intersex appears. When this intersex is actually a pseudo intersex, because genetically the individual is either male or female. However, due to elevated androgen levels, the phenotypic and the genotypic appearance is being altered. Now, it is caused by mutation of genes for enzymes involved in adrenal cortex steroid biosynthesis. So, adrenal cortex is actually the site for synthesis of the steroids in the human body. And when enzymes that are responsible for this synthesis are deficient, it may or mutated, they may lead to congenital adrenal hyperplasia. Now, what is adrenogenital syndrome? So, in adrenogenital syndrome, in this condition, there's congenital hyperplasia of androgen secreting cells of the adrenal cortex. So, it is now the cells which are secreting androgens, they are hyperplasic, that they undergo hyperplasia. There's increase in their number, as a result of which the amount of circulating androgens in the body increases. Now it has different effects on on different genders, so we'll take them one by one. So first of all, in males it may lead to adrenogenital syndrome. Adrenogenital syndrome may lead to development of the secondary sexual characters very early on in a child, and this is due to increase in the amount of circulating androgens. Now, in females, we can have pseudohermaphroditism. Now, there may be enormous enlargement of the clitoris, and child is mistaken as a male. This is again due to increased amount of circulating androgens. These circulating androgens cause enlargement of clitoris and lead to pseudohermaphroditism. Now, moving on, we have pheochromocytoma, a very important tumor. It is tumor that arises from the chromaffin cells or from extra-adrenal chromaffin tissue. So, pheochromocytoma is actually a tumor of the chromaffin cells. It may either be within the adrenal medulla or it may lie in the extra-adrenal chromaffin tissues. So there's excessive secretion of both the adrenaline as well as noradrenaline. So it usually presents itself with hypertension and the features of sympathetic overdrive. So the features of sympathetic overdrive means palpitation, sweating, apprehension, and fear of death. So a patient would be very apprehensive, would be undergoing massive sweating. He would be saying that I can feel my heart racing rapidly, and there would be fear of death in the patient. These are the symptoms of pheochromocytoma. The blood pressure would be very high. It's a clinical emergency and should be managed as such. So this was all about this section. In this section we saw the clinical correlates as to what happens when the developmental process does not of the adrenal development does not go as planned. We saw various anomalies that occur, and we talked about pheochromocytoma and how and what were the clinical presentations of the pheochromocytoma. I hope you understood and liked this section as well as the lecture. For further such lectures, keep watching sqadia.com.